cell trait, and how do you best explain it for someone that just doesn't know sickle cell at all?
Okay, so first of all, it's not a disease. And that's the most important thing one of the most important things for people to hear and understand. A lot of times when you mention the term sickle cell trait, what happens is people get focused on the sickle cell and they don't hear the trait. And then that leads them into a little bit of a panic. And so especially in my situation, I work in pediatrics, so I'm dealing with newborns all the time. And so parents, sometimes I lose them after I say sickle cell before I even get to the trait. So I try to reassure any individual, whether it's a parent or a child, that when we talk about trait, we are not talking about a health problem. We're not talking about a disease. And we're definitely not saying that someone has sickle cell disease. What we are saying is that that this person is a carrier for sickle cell. Okay, so and really when you drill down as to what a carrier is, we're really talking about a genetic difference that is coding for a different hemoglobin in the red blood cell, okay? So when people have trait, they do have some different hemoglobin in their blood, most commonly the sickle hemoglobin, but that hemoglobin is paired with lots and lots of normal hemoglobin, okay? And so it doesn't have an effect on the cell, and it doesn't have an effect on the person for the most part. So people with sickle cell trait are asymptomatic. They don't know that it's there most of the time. There's no clue medically, health-wise, physically, nothing's different. But there is a gene that is coding for the type of hemoglobin that we make. And we all have 2 copies of that gene. And when you have the trait, you have 1 copy that is abnormal or different, paired with the partner copy that is normal, okay? And so figuratively, we will say that a person with trait has A and S, combination of these 2 genes, which are coding for the 2 hemoglobins, A and sickle, okay? And this is contrasted with somebody who has sickle cell disease, because people who have disease have 2 copies of the abnormal gene. So they don't have any A, at least most forms of sickle cell disease don't make any hemoglobin A. They make something different. And both copies of the gene are coding for S. In the case of sickle cell anemia, both copies are S. We call that sometimes hemoglobin SS. And the genes, of course, are S and S. So when a person has trait, it does not become disease. It is not a bit of the disease. It is not a trace of the disease. It's not half of the disease. These are, of course, all the things people tell me. It really is a carrier, and you're a healthy, normal person who happens to carry a gene for a different hemoglobin, period. Okay?
Nice. How does a person know if they have a sickle cell trait?
Well, as we just said, you can't really tell by medical history. You often can't tell by family history, because a lot of times most people who have trait don't know they have it. So even though it is technically running in the family, you're often not aware that it is. So really the only reliable way to know if you have trait or not is through a special blood test. And it isn't just any blood tests. So like when you go to the doctor and you're getting a physical exam and they order all these labs and you get all this blood drawn, not one of those tests will detect whether a person has trait or not. It's not part of standard medical practice because it doesn't cause a health issue. You're not going to the doctor because you have trait. You're going to the doctor because of some complaint that you have, whether it's related to blood sugar or blood pressure or something else, but there's a complaint, there's a problem. And with trait, that's not the story. So you really have to, if you want to find out if you have trait, you have to seek it out. And I think that's what makes it so tough, and why so many people aren't aware is because, first of all, you have to know to ask for it. And second of all, you have to ask for it. You can't assume your doctor's going to just do this automatically. And so, and then it's complicated because a lot of times when people ask to be tested for trait, they get this sort of quick, inexpensive test called a sickle cell screen, or, years ago it used to be called Sickle Dex, but either way, it's not an analytical blood test. It's a quickie test that gives a quick answer, but it's also got a lot of false positive or false negatives to it. So you can have a normal test and actually still have the trait, or you can have a normal test and have a different type of trait, because it isn't just sickle cell trait. There's hemoglobin C trait and beta thalassemia trait and hemoglobin D trait and hemoglobin E trait, and on and on and on we go, because there are lots of variants in the type of hemoglobin that we can see worldwide. So you have to have a good analytical test that can distinguish between these different types of hemoglobin present in someone's blood. And so classically, that's called hemoglobin electrophoresis. Now, I do have a slide. So this is the testing that I'm talking about. It is not a DNA-based test. It's a test that's looking at the product of the gene. So the gene is like, the DNA is a code for an instruction to the cell. And generally, DNA is telling the cell to make some type of protein. And in this case, the protein is a chain that's involved in forming hemoglobin. So hemoglobin itself is comprised of two different proteins. One is called alpha globin and the other one's called beta globin.
No.
And the gene for sickle cell has to do with an altered form of the beta globin, okay? And so when we do electrophoresis, we're looking for this protein variation. We're not looking at the DNA code, all right?
Okay.
Okay, and so, but still it is an analytical test, because through both identifying the types of hemoglobin in the blood, as well as identifying how much of each hemoglobin is present, the combination of those two facts allow us to interpret what the genes are likely to be, okay?
Okay.
And so this testing is a little bit more accessible than doing a DNA test. DNA testing is usually requires insurance authorization. It's a little bit more cumbersome and certainly more expensive than doing an electrophoresis. And so many places will do this type of analysis at first. And if they can get answers that are reliable, they'll stop at that. We often only use DNA testing when things are confusing and we have to get a even more detailed analysis done. Okay.
Okay.
So, and hemoglobin electrophoresis has major advantages over sickle cell screening because we can identify any altered hemoglobin. So any variation of a hemoglobin should show up to some degree on this analysis. Okay.
Nice. Okay.
And so, like I said, there are other forms of trait, and this allows us to pick up those other forms of trait.
Okay.
Now, sometimes we have to do follow-up testing in addition to this, but it's a good starting point, and it picks up a lot of the majority of trait, it can be diagnosed through electrophoresis.
Nice.
Okay, so that's a key step in detecting or who has trait. But I think the bigger step is getting people to this point, you know, and helping them understand that a test is required, that they can't rely on what they know about their family history. They can't even rely on what their doctor may know because their doctor probably hasn't tested them for this.
Yes, and part of that mentioned like what are some of the resources that's out there for people that like that deal with that kind of thing?
Well, you know, I would say that in general, um, the global answer to that question probably is genetic counselors, because we specialize in helping families um, address concerns related to genetic problems, and that includes getting proper testing done. That includes understanding the testing. That includes understanding the inheritance, looking at family history, seeing what the family experience is, helping people understand the family history, and then using the information that we get from testing to help individuals and couples understand what that could mean for their own children. So there's a lot of education and counseling and support just embedded in the process of meeting with a genetic counselor and engaging the services of a genetic counselor for follow-up.
Nice. All right. I believe that almost, let me see.
So I think one of the other things I wanted to, can you see this slide?
Yes.
Okay, because one of the other things I would like to make sure we review is the fact that something I alluded to earlier, which is that people who have trait, number one, they're born with it. Number two, it's something that is the result of a difference in a gene, and that gene is passed on from parents to children on down through the generations. So a child who is detected to have trait inherited it from a parent who also has the trait. And so if you look at this diagram that I have on the screen, this is one way to illustrate inheritance. I don't like this diagram because it symbolizes half of the person. And I don't want people to get the idea that they have half of the disease, which is sometimes what happens when I use this diagram. But what it does show is that if one parent has trait and the other one does not, the children can only have trait or normal hemoglobin, right? Can you see that?
Yes.
And then if it's only when both a mother and a father have the trait, they both have to be carriers of this genetic difference in order for there to be a chance for a child to get both copies of this abnormal gene. Okay? So that's another key aspect of testing. When we talk with people about testing, it's not just for them, it's also for their partners. And it's important for both members of a couple to understand how this is beneficial to their future in terms of family planning. Okay.
Nice.
And then this slide I like better because it really drills down to what the primary issue is, and that's a difference in the gene, right? So a person who has trait has a normal A gene paired with a sickle gene, okay? At least for sickle cell trait. If you have both parents with trait, when we have children, we only pass one copy of every gene at a time, okay? So you can't pass both your A and your S. You either got to pass an A or an S, right? And it's kind of like a flip of the coin. It's a random process as to which gene is passed on to a child. So it's random for this parent and it's random for this parent. What this slide illustrates are the different combinations of the genes that are possible given this couple, okay? So you can get an A from each parent, and even though both parents have trait, this child doesn't even have trait, right?
Yeah.
And then, of course, you can get an A from one parent and the S from the other parent, and then you can flip that around, get the A from here and the S from here, and that both of these are children with trait. And then, of course, there's the possibility that the parents could each pass on an S at the same time, and this is the child who has sickle cell anemia. And this is often very hard for couples to grasp because, first of all, you have two parents with trait. How can they possibly have a child with no trait? You know, that kind of doesn't make logical sense, right? But then when you see how this plays out with the genes and how we pass just one copy, it starts to pull together. And then, of course, there's the chance for this sickle cell disease. And the other thing that is difficult for couples is that I have to tell them that every time this couple has a child, any one of these is possible. So it's not like if you have a child with sickle cell, you're done with that. And now it's going to be one of these other ones. It doesn't work that way. Every pregnancy has all four of these possibilities with each and every pregnancy. So these are important implications for couples to understand. And this is part of what we as genetic counselors do. It's a resource available to couples so that they can first understand either their own test result or their baby's test result. And then secondly, understand how this is passed on in a family and what this could mean for the future.
Okay.
So I think that part of the resources is, you know, obviously education and counseling, but I also think some of it is really empowerment. I mean, really what we're trying to do here with awareness and community awareness and all of that is building, you know, knowledge is power. We can't change. Nobody can change the genes they're born with. You know, it's not anyone's fault. We have no control over the genes that we got from our parents. We have no control over the genes that we pass on to our children. It's biology and it's random. But we can try to know what we know and understand the implications of what we know. And that's where the power comes in, because knowledge is power. It gives you some tools to be better prepared.
What message do you have for people that live with sickle cell?
Well, and I actually think about this in terms of trait in particular, because I think there are lots of stumbling blocks for people who potentially have trait and finding out if they have trait. And one of them is just knowing that you need to be tested. You know, that the only way to know if you have trait or not is to be tested. But I think even before you go down that pathway, it's important to understand that what's the reason for testing? Why are we doing this? You know, why would somebody want you to get tested? Is it to blame you? Is it to make you feel bad? Is it, you know, to prevent you from having children? I mean, what's the point here? And the point is really just being better prepared, having knowledge and information that are tools that you can use to make decisions that work for your own family, you know, that will benefit your own family. And so it's a tool, and it's there for you to take advantage of so that you can be in a better position of understanding if by chance your child is born with a disease. At least you understand how it works, where it comes from. It's not your fault. It's a product of biology. You know, these things are important emotionally for coping. I mean, you never can take the pain away from having a child with something unexpected, but you try to help people deal with it. And part of that is knowledge. And so my message to people is don't be afraid. You know, don't, whether it's the fear of the needle, which sometimes it is, don't want to get poked,
Oh, yeah.
or whether it's angst over, you know, what's going to happen with this information. How is it going to get used? How will it benefit you? You're not certain it will benefit you, you know, those kinds of things. But the message really is to not be afraid and to talk with people. There are resources from genetic counselors, from your physician, from nurses, what have you, whoever in the medical field you trust, talk to them and get the real information. What's the real deal about this testing and how will it help me? And so I think that's one of my messages for people with sickle cell. And the other key message for people with sickle cell or who might have the trait is that you're not going to know without testing. And most people who have trait don't know they have it. And actually neither does their doctor. So we can't rely on these normal tools.
I see.
We have to seek beyond.
Nice. All right. I think that concludes it for this interview. Unless there's anything else you want to add on.
I don't know if there's anything else. I mean, I was going to just let people know that there are genetic counselors all over the place. And there are lots of ways to find them, but you know, the best place to start is to talk with your physician, your own personal physician or medical provider. They can help you get in touch with resources as it relates to genetic counseling and testing. And that's probably the best and most direct way to do it. I mean, there are websites and there are directories and there's all kinds of resources online, but probably the best one is through your own medical provider.
Awesome. All right. Well, I guess all the questions are answered here. But I would like to say thank you very much for your time, and like, you know, very knowledgeable, very in details as well. And
Great.
yeah.
Thank you.